Welcome to Tame the Taboo. This podcast is brought to you by Discover Health. Discover Health specializes in healthcare, education, and resources for her most intimate concerns. I'm your host, Nurse Jenna Ray. I'm a women's health and gender-related nurse practitioner, and I am making it my business to take you from sufferer to sensei. So if you are suffering from conditions that are not easily treated in an annual exam, or you want to join me on this journey to become my healthiest, wealthiest, best business owning self, sit back, relax, and enjoy these episodes. Okay, welcome back to another episode of Tame the Taboo. I have been looking forward to this episode. We have the one and only Dr. Rachel Rubin here for the podcast today, and I'm so excited to bring her and let her show off how amazing she is. And just to allow you guys into our conversations, we have a lot of parallels in our lives, and so I just want the world to be able to take a glimpse as to the types of conversations that we have. So welcome, Rachel, to Tame the Taboo.
I'm so happy to be here. This is a long time we've been trying to plan this, and you and I have been having conversations for years.
Quite literally years. Yeah, I feel like we've kind of grown up together in the sexual medicine world. Dr. Rubin is a world-renowned urologist, and instead of just focusing on the pee and the penis, she has taken the road less traveled and focuses on all-encompassing women's sexual health and also men's sexual health. So taking a deeper look at like the clitoris and how we can provide proper clitoral care and how we can actually care for women who have pelvic pain conditions. So it's an honor to have you here today. So for the people who don't know who you are, Dr. Rubin, kind of give your spiel, like who are you?
Yeah. So I'm a urologist, like you said. In urology, we're surgeons of the genitourinary tract, which means we're penis doctors. And you have to be kind of funny if you're a penis doctor because you can't take yourself too seriously and you have to have a sense of humor. And so I did a 5-year surgical training in urology and then decided I wanted more. I wanted to do a fellowship in sexual medicine and really care for all genders when it came to sexual problems. And what's interesting is in the medical world, we have 27 fellowships for male sexual medicine and only one fellowship in the country that even acknowledges women's sexual health. And it's the fellowship that I did with my mentor, Erwin Goldstein, who you should totally have on the podcast. I'm sure he would love to come. And we really focused on sexual medicine for everybody. And so when I left my fellowship in 2017, I had trouble finding a job and finding a place where they kept telling me, you're not going to make us enough money. You're not going to make us enough money because insurance companies don't really care much about sexual medicine. And so I ended up going ultimately on my own, starting my own practice and really basically spending time with people and saying, like, I give a crap about your quality of life. I can't get to know you in 10 minutes. I certainly can't. No doctor can. I mean, it's a joke. Medicine is right now, it's just a total joke. The fact that we think we can even do anything in 10 minutes. And so I take a lot of time with people and I really dive into quality of life issues. I joke, I do 4 things. I deal with arousal, orgasm, desire, and pain, and anything that goes into that. So we see a lot of menopause. We see a lot of pelvic pain. I see men's sexual health conditions. I do a lot of hormone therapy. And it is so, as you know, because you do this work also, it is so magical to help people with their quality of life and to be there for them. And it's just a joy. It's just a joy.
Yay. So I like to say that I practice and freeing women from shame, right? So freeing women from guilt. And you can't, like you said, do that work in 10 minutes. And so I always like to bring up this visualization of when I first started practice, my hand constantly being on the door. So seeing someone with recurrent UTIs at my busy downtown practice and having to say, okay, well, we can talk about this in 2 weeks at a follow-up visit, but I can't address your concerns today. And then going into the next room and saying the same thing with my hand on the door. I know that you are talking to me about like your sex life, but I just can't hear it right now. I don't have the tools, which is time, to be able to give you what you need. So I got to go, but I'll see you back here in 2 weeks. So how important for you was it to create your own space and do things on your own?
Yeah, I joke all the time. I said, I can't fix medicine right now. I can't fix the whole system. And it is broken. It is broken The doctors don't like not spending time with people. The patients don't like getting 10 minutes and a $40 copay. Like, no one is happy. The insurance companies aren't happy because they just want more money, right? Like, nobody is happy. And so I can't fix it. And so I would say I have my own little house, my own little office, and my own little space, and everyone can leave me alone. And the people who want to spend time and focus and invest in this part of their life, I'm here. And so, I think of it as really, address biopsychosocial is I take all of it. I take the person and I try to get the biology to make sense. I try to get the psychology and the social to make sense. And I really try to educate the patient, because it doesn't matter what's right or wrong. It matters what the patient believes and how educated you have made them into understanding why they can use the tools in our toolbox. Because no one's going to do hormone therapy because I tell them to. They're going to do hormone therapy because they've done their own research. They feel confident. They know what's right and wrong, and they understand the data to the level that they want to understand it. And so it's really, education it's really everything, right? And in the medicine world, we love to call people non-compliant. Oh, she didn't use her treatment that I recommended for her. She's non-compliant. And I teach the trainees. I do a lot of speaking and I teach a lot of the docs. I said, they're not non-compliant. You just suck at selling. You suck at explaining what to do. And if they didn't use it, you didn't explain it right. So let's go backwards, right? And so I agree. Yeah, absolutely.
Yeah, and it's hard. So Discover Health, healthcare education and resources. Education is in our middle name, right? It's baked into the bread of what we are offering here. And like you said, time is really the only way that we as providers can truly educate our patients. We always have that one client when we recommend vaginal estrogen because their vulvovaginal tissue is erect because of menopause or postpartum or whatever the case. And then they go and they get the prescription and they read that nasty black box warning on the label. And it really makes a difference if I am able to spend 5 minutes and say, here, you're going to get the label. It's going to scare you, but I'm going to teach you all about it so that you don't freak out and not use it. So what are our counterparts doing in those 10-minute visits when they can't give that level of education? It's more of a rhetorical question because I know
you know the answer. You know the answer. It doesn't work. It doesn't work. And so that's a perfect example, right? So for anyone who doesn't know, vaginal estrogen, what we're just talking about, is a treatment for something called genitourinary syndrome of menopause, or GSM. And that's what happens to the bladder, the urethra, the vulva, and the vagina. That's what happens, when the genital tissue doesn't have hormones. It becomes thin, it becomes raw, it becomes irritated, and you get urinary frequency and urgency, leakage. You may get a urinary tract infection, which is dangerous and can kill you, right? Pain with sex because you get dryness and irritation. And there is a therapy, a treatment that has been around since the 1970s, right? Since the 70s, we've had a magic treatment that fixes this problem, and no one uses it or prescribes it because of education. It's just education and the fear that there's perhaps something dangerous about it, which no data supports the danger. And so it's all about taking the time to educate patients of, hey, we've had female Viagra since the 1970s. Vaginal hormones, either vaginal estrogen or DHEA, will prevent urinary tract infections, fix dryness, fix arousal, fix orgasm, fix pain with sex. Again, Viagra doesn't prevent urinary tract infections, so it's even better than Viagra. It's female Viagra that cures urinary tract infections. Like, how is that not on a billboard somewhere, right? It's because of sales. We're not selling it correctly.
And so that's where we come in with our practices, and we have to put on a different hat, right? So we can't just be clinical providers providing this education and these tools. Now we actually have to learn to do the business portion of it, which we started our businesses around the same time. So we're looking at a year and a half of being in practice. So can you kind of share with me and share with the audience, like, what has been some of the trials and triumphs of being a businesswoman and having to go into sales?
Oh, it's been the joy of a lifetime. It has been, started my practice, and I loved having you, along. It's been so fun having people along in different aspects of business and growing a community, people who are ahead of you, behind you, who are at the same place as you. It's so fun because not a race. It is just this amazing journey that everyone just gets to at different times. And starting my business 18 months ago, it really is, I always joke, I learned how to do penile implants. How hard can QuickBooks be, right? How hard can this business thing be? And I find myself at times panicking of like, oh my God, I don't know anything about business. What do I know about business? And here it is running this, really thriving, wonderful business. And the point is like everything is learnable. All business points are learnable, and it's fun. It's fun to learn. It's fun to build a community and to find information. What I have found is that people are so kind with their time, with their knowledge. Everyone wants to help you. But when it's your business, you don't have to take everyone's advice, right? Someone will tell me, I've heard this, right? Some of the people that who maybe have some more gray hair than either of us, and said, oh, Rubin, you'll never succeed out of Washington, D.C. You're going to be you're going to be in the suburbs. You will never succeed. You got to go to New York. If you don't go to New York, you're not going to do well. Our wait list is long. So it really, you don't always have to listen. And it's okay to dream. It's okay to do it your way. And it doesn't always have to be a path that you've seen before. And it's been so fun. What about you? What are the triumphs for you?
I think definitely walking into the role as a designer, right? So I never thought that or recognized that what I was doing is actually working as a designer. I was designing a practice within a busy academic center and meeting so much friction. So now that I have the freedom in my own business, I can truly design it from top to bottom and say, hey, yes, you're giving me that advice. It's probably terrible advice, right? And also, I'm going to use it as fuel, because when people tell me that I can't do something, that's like, okay, you just lit me up,
You and I are fueled by very similar things. Yes.
Yes, we have lots of similarities. So I think, when I was actually working as a nurse practitioner, my story intimately, some people might not, but working at a business, at an academic center, and basically went to them and was like, hey, this is hard work. This is taking a toll on me. I just had another baby. I have 2 kids, both of them very tiny, and I need more money. And they essentially laughed in my face and was like, we don't pay nurse practitioners that much. We don't pay people who do sexual medicine that much. You will never be able to get what you are asking of us. And so that really was the final kind of kick in the rear to be like, okay, let me get on this. Let me start my practice. And ever since then, I just think about the words that I heard, on my exit, and that refuels me every single time. So I thank people for the terrible advice.
It actually is the blessing, right? We've all been there. We all have those stories, and it is incredible how much success I have been given because I didn't have a choice. I was forced into these decisions, and I didn't, maybe I tried to go down the normal path and it didn't work out. And because of that, I was forced to sort of take the unpaved path, and it's a blessing, right? It's a blessing. And when I got out of fellowship, I had a contract in hand from a very busy urology practice owned by private equity. And the private equity people said, you're not going to make us enough money, lady. We're taking the contract away. Thank God. Thank God for that, right? Like it was very hurtful at the time, but man, is the fuck you tour pretty fun.
Yes, it really is. I love that. The fuck you tour. I'm right there with you. So we talked about like what it looks like to be a clinician, kind of battling the messaging that our patients are getting and having to really dedicate ourselves to also being educators, and then taking it a step further to being a businesswoman and putting on the hat of having to do sales and messaging and do podcasts like this. I never would have done a podcast without a business, right? But now I recognize that my voice has power and I have to use that power to spread the message. So the other piece of the puzzle where we have a lot of parallels is our motherhood, right? Like we are both mothers. How has being a mother influenced you and your work?
I'm blessed to have an incredible partner who does equal, if not more, heavy lifting parenting, and is just really helpful and wonderful. And there's no like man woman role of like, you do this because I don't have that. I don't do the cooking. I don't do the grocery shopping. Like I do the laundry. I still fold laundry and I still do plenty of things. And so that I'm always blessed that I was born in this generation. I'm so blessed. And I also know that my kids are watching me and watching what I'm doing and seeing how fulfilled and happy and motivated, and they see people watch what you do. They don't necessarily care what you say, but they see how you feel, like what you do. And I think they'll just ultimately, I'm hopeful that they'll really be proud and excited about helping people, helping the voiceless, right? I do feel that we help people who have these silent diseases, these diseases that they can't talk about, they can't go on. We're helping people who it's no one else wants to help. And that is really incredible work that we do. And hopefully they'll be able to see that. They'll be able to say the word penis and vulva and clitoris and those fun things too. Yeah, it's a lot to have small kids and do the business, but when you are doing what you love, and it's a joy. I skip into work every day. I find today's Friday. I find Fridays challenging because it's, oh God, I have to, be mom all weekend. Work is a little bit easier, to be honest.
Work is a lot bit easier, okay? My kids require a lot of my patients require a lot of time and attention and care. But kids are just different, man. They don't care that you are this big boss lady with your own business.
In fact, I was on NPR yesterday and I played about 4 seconds for my 4-year-old son, and he's listening to it and he said, "This is boring." They couldn't care less.
They could not care less. Yes, my daughter will be 4 in August. And yeah, she sometimes hears me and she's like, "Mommy, is that you? Why is that you?" I'm like, "Yeah, that's me." So they humble you for sure. Keep us grounded. So what are some of the things that you are working on over there at Rachel Rubin, MD? Like, what do the girls need to know?
Yeah, so our practice is growing. We see patients. We have another urologist, Dr. Kloss, who's incredible, who's working with us. We are doing some cool studies. We're always looking to do more research and to help more people. We see men too in our practice, so we see all genders. We're hoping to get into some more events kind of a thing. So if you're interested, you can sign up at rachelrubinmd.com. We're always sending things about events. We have one on Thursday of this week, which probably won't be out by the time this podcast gets published, but about orgasming with confidence, where we're working with a sex therapist who's going to do a virtual workshop with us, which is going to be great. This idea that not everyone wants to jump into sex therapy. They don't always know what it's about. And people may like the idea of devices and orgasm and all of this, but how do you talk about it with your partner? How do you even talk about it with yourself? How do you get started? How do you make it a priority? It's the little things that maybe this is important, but you don't necessarily know how to do it. And so we're going to do a workshop for that, which is going to be great. I'm hoping in the fall to do a workshop about weightlifting, right? I want to get more osteoporosis sort of knowledge out there and even for myself, right? And to maybe do some group weight training type of a thing. And so, I'm just always thinking of ideas and, going out on social media and yelling and screaming and fighting the good fight. And I want to go to the FDA and get that box labeling changed more than I've ever wanted anything in this world. So I hope to build and help to become a part of an army that does that. And so there's so much excitement ahead.
That's great. It's always something to do when you are revolutionizing women's health. It's always another project.
Well, there's just unlimited work to do, as you know. And so we need more Jenna Perkinses of the world. We need more people. I would love to start a fellowship. We need to train more people how to do this. Sexual dysfunction is not a boutique problem. It is not a limited problem. And so it needs more wide acceptance.
Definitely. I agree. And that's one of my passions too, is educating not only my clients, but also other providers to say, as a nurse practitioner, as an MD, whoever you are, we have to have these skills because any patient that you're seeing is going to have something to do with their pelvis, right? The pelvis is the seat of life. It is where most of our essential functions come from. It's where you pee, where you poop, where you birth, where you have sex. And so if you have a patient that is doing any of that, you have to have these skills to be able to care for them properly. So yeah.
And this is funny. I had a patient actually just 5 minutes ago who said to me, the last patient I talked to, she said, "Doctor, it is like women were just invented. It is like vaginas are brand new and no one's ever heard of them before. What the hell? Why is there so much poor knowledge and nobody knows anything about what's going on?" I said, "That's so funny. I got to talk about that. You're so right."
Yeah, we did not just fall on the face of the earth, right?
We just got invented.
We've been around. And not only that, but without a vagina, there would be nothing else. Without a womb, there is no life. So it is literally the seat of humanity.
It's such a fascinating thing. I say this to patients all the time, because as you know, all of our patients, when they look at their own genitals, there's this, disgust, this grossness. I say, "What are you talking about? Look at your elbow. You feel neutral about your elbow. You don't feel positive, negative. It's just a body part. You don't think about your elbow." So your vulva, your clitoris, your vagina, literally, it gives you pleasure, it gives your partner pleasure, it gives human life. Mm-hmm. And it gives you yuck feelings. It's gross. It's icky. Lord, we have so much work to do. I mean, that alone, if that alone doesn't describe how messed up this all is, I don't know what does.
Yeah, because we've been disempowered as women, as human beings, really, because this is not just a woman issue, right? Like when we are taking away the power from the woman, we are taking away the power of the family. We are taking away the power of the people that the women create, which include men. So I make it a priority for every single client that comes in my door to see with the mirror. Here it is. Because also, this is not my problem, right? Like, I am here to help you. I can't fix you without you being an active participant. So if you don't know the difference between a vagina and a vulva, we're starting, off on the wrong foot. So
How do we get that? How do we make that universal?
more time. We got to boot the insurance companies and tell them that we need to spend time with people to make sure that we are educating people on their anatomy. And
can we buy mirrors for every doctor or something?
Find them at shop.discoverhealth.com. We have mirrors with LED lights where they're the between the legs mirror so that you can literally put them between your client's legs. And yeah, I just actually created these kits. So I have the Tame the Taboo kit. So it's postpartum, pain, pleasure, and it's one more that I'm missing. But I've created these kits and every single one of them has a mirror in it with a light because you have to know the anatomy. So we'll see. Maybe we should go knock on doors and just like pass them out to everybody. And you'd be surprised how many providers too, like how many people have gone through nursing school, gone through medical school, and they don't know the anatomy, right? Like you've never looked at a clitoris and you've been putting speculums in your entire career. So yeah. But so tell me right now, you're working on doing events and being able to just like walk into your freedom and really make your practice what you want it to be. What are some of the takeaway points that you want your clients to know? Besides the black box warning, doesn't matter, ignore that, use the vaginal estrogen, and that you have to know your anatomy. What's something else that you think is super important for our audience to hear?
I think it's just learning how to advocate for yourself. And if you're bothered by it, it's a problem. And so if you have low libido and you want it to be higher, don't let a medical provider tell you that it's normal and you shouldn't worry about it, right? It does matter. And there are tools that we have in our toolbox to help you. If you can't orgasm or you want to know if you can orgasm a different way, and there are people out there who can help give that information to you. If you want to learn how to communicate better with your partner, and that's important to you. So I think the key is just advocating for yourself and knowing what you're allowed to ask for. If you think hormone therapy is dangerous and causes cancer, and your doctor has told you that that's true, maybe get some different information, right? Learn, read, explore. Now, not all information is equal. There's a lot of bad information out there. There's a lot of misinformation out there. But when you go after resources or follow people who this is their life's work, this is what they care about. And sometimes you have to travel, right? Sometimes you got to go someplace else to find someone who's going to give you the time and the space and the knowledge that you are looking for, because not every doctor or nurse practitioner knows the same things and knows everything. Nobody knows everything. In fact, part of what makes me a very good doctor is I spend a lot of time saying, well, we actually have no data for that. And I have a group of medical students who do constant amounts of research and are publishing constantly because we are spending so much time saying, well, we actually don't know anything about that. And so we're doing the work, we're doing the research, and we have unlimited amounts to do, right? And so having doctors be honest with you and say like, well, we actually just don't have data for that. Here's what we can do. Here's how we can experiment, or here's what we can try. And also, I am a fierce advocate for quality of life. And so I push patients, patients who say, oh, Dr. Rubin, I'm fine. Yeah, I've got hot flashes and night sweats and osteoporosis and vaginal dryness and pain with sex. And I'm fine, Dr. Rubin. There's nothing wrong with me. And I'm there to say, hold me back. You do not have to live like this. And there are options, and there are safe options and effective options. And you deserve to know what they are. And you deserve to to get to decide for yourself what risks and what you're willing to put up with. And I think oftentimes the risks are a lot lower than people think they are. So those are the things that I would say. It's just, don't take no for an answer. Don't think that 10 minutes once a year with a pap smear is all you need to take care of your health. That is horrible. And that is not the way that it should be. And you deserve to invest in your sexual health and your quality of life. And it matters to you, then it should matter to your doctor.
Definitely. And just because you're not dying doesn't mean that you're living, right? And I have a lot of clients who have gone through cancer diagnoses and who are just stuck in relationships where they feel like they can't return to their former selves, even though they don't have the cancer anymore, but they're not living an active life. And so it is important that when we are thinking about healthcare, we are thinking about making people their best selves, allowing them to thrive and not just, waste away. You didn't survive cancer just to waste away.
And if I don't get to know you, how can I help you get to your best self, right? That's the other thing. If your doctor only talks to you for 10 minutes once a year, how are they going to give the best advice that is going to be customized to you? Because the more I learn, the more I understand that people are so different, and you got to meet people where they are, and you have to understand what their fears are, what they're, what they want, what they don't want. Because you can give all the prescriptions you want, but it doesn't matter if they don't use it or if they don't understand why you're doing it.
Definitely. So how do we get our clients or prospective clients to invest? Because so many people are like, but I pay so much money for this insurance and I got the Cadillac of insurances and I'm not going to come see you because I want to use my insurance.
You cannot help everybody. And the key is just keep putting good information out there, and you will find that people are listening. They're listening, and it will snowball, right? And then you won't have time to see all of the people who want to come in. That's the key, is you be consistent and you be you, and then your ideal people will find you, because you don't want to see someone who doesn't value who you are and what you do. You want to see the people who know, like, and trust you. And the more you put out there, the more people will watch a video or hear a podcast and say, oh, damn, she looks like me. She sounds like me. She seems to get me. And they'll show up, right? That's the key, is like when people feel heard and they feel valued, they will show up and they will invest. But if they don't know you exist, they ain't coming, right? That's why you got to get yourself, and you're doing it, right? You're doing all the right things, and you just got to keep going and know that your people will find you.
I appreciate that. I love seeing you on social media. I love seeing you IRL in real life. I look forward to working with you on the education committee for ISSWSH, the International Society for the Study of Women's Sexual Health. That's a new development that I'll be joining the education committee. And I really thank you for your time today, Rachel. It has been such a pleasure.
Thank you for having me.
All right. We'll catch you next time on the next episode of Tame the Taboo. Thank you for tuning in to this episode of Tame the Taboo. If you enjoyed it, don't forget to hit like, share, and subscribe. Send this to your girlfriend so they can join you on your journey as we transition to our healthiest, wealthiest, best selves. See you on the next episode.